Today's topic, hepatitis C and kidney disease.
Hepatitis C is a viral disease that affects the liver.
The liver is an organ in the human body that converts everything you eat or drink into nutrients and gets rid of toxins.
There is a connection between hepatitis C and kidney disease.
Hepatitis C can cause kidney disease, and sometimes kidney patients can get hepatitis C from hemodialysis, a treatment for kidney failure, if a medical facility does not carefully follow guidelines for infection control.
Hepatitis C in the liver.
Hepatitis C is a disease that attacks the liver.
It is caused by the hepatitis C virus, which is spread by coming in contact with the blood of a person infected with hepatitis C. The hepatitis C infection can be acute, it happens right away, or chronic, it is ongoing.
An acute hepatitis C infection usually happens in the first 6 months of being infected with the virus.
Most of the time, acute hepatitis C infection will lead to chronic hepatitis C infection.
Acute hepatitis C usually has no symptoms.
A chronic hepatitis C infection happens when the virus stays in your body for a long period of time. You can have chronic hepatitis C for many years without realizing it.
Chronic hepatitis C can sometimes lead to serious damage of the liver or even death.
Hepatitis C causes the liver to become inflamed, swollen, which can affect the body's ability to work properly. If not treated, this disease can cause permanent damage to your liver, and can lead to liver cancer or liver failure. This is why it is important to be tested and treated early for hepatitis C to prevent or delay serious liver damage.
How do people get hepatitis C?
Hepatitis C is spread when the blood of a person who is infected with hepatitis C gets into the body of a person who does not have hepatitis C.
Hepatitis C infection happens the most in people who share unsterile, dirty needles for injection of illegal drugs, for example, heroin.
Are being treated in a healthcare setting where needles or other medical tools are not sterilized, cleaned, in the right way.
Much less often, hepatitis C can happen.
When a child is born to a mother who has hepatitis C.
From having sexual contact with a person who has hepatitis C.
From sharing items like a toothbrush or a razor with a person who has hepatitis C, the gums sometimes bleed on a toothbrush and people sometimes accidentally cut themselves while shaving.
In the past, hepatitis C would happen from
medical procedures involving donated blood, before 1992.
Before this time, the screening process for blood diseases within donated blood was not well controlled.
medical equipment contaminated with hepatitis C, before strict infection control was required.
Some people are more at risk than others for having or getting hepatitis C. People born between 1945 and 1965, known as baby boomers, are the age group with the greatest chance of having hepatitis C.
The Centers for Disease Control and Prevention, CDC, now recommends that all people born between 1945 and 1965 get tested for the hepatitis C virus, to be sure they did not get it years ago.
It is estimated that between 1960 and 1980 most people were infected with hepatitis C because of getting donated blood that was contaminated with hepatitis C.
Having a medical procedure in a healthcare setting that did not use strict infection control.
Sharing needles for injecting drugs.
Those at risk for getting hepatitis C are
people who use illegal drugs that are taken by injection using a needle, for example, heroin.
People on hemodialysis.
healthcare workers who work with people who have hepatitis C.
People with HIV/AIDS.
Children born to mothers who have hepatitis C.
People who received donated blood before 1992, before there were laws requiring clinics to make sure there were no diseases in donated blood.
Those who may be at risk but their risk is less.
People who have sexual contact with people who have hepatitis C.
People who share personal items like razors and toothbrushes with people who have hepatitis C. The gums sometimes bleed on a toothbrush and people sometimes accidentally cut themselves while shaving.
Symptoms of hepatitis C.
When a person is first infected with hepatitis C, this is called an acute infection. During the acute infection, most people do not have symptoms.
If symptoms do happen, they can include fever,
fatigue, feeling very tired, not feeling hungry,
feeling nauseous or sick to your stomach, vomiting,
dark-colored urine, pee. Gray-colored bowel movements.
pain in your joints,
jaundice, having yellow-colored skin or eyes.
Since most people do not have symptoms of hepatitis C when they first get it, they do not know they have it.
You can live for years with hepatitis C and not know you are infected.
Over time, hepatitis C can lead to liver damage, liver cancer, liver failure or even death.
Symptoms that show your liver is damaged are
swelling in your abdomen, belly area, Bleeding easily. Bruising easily.
Fatigue, feeling very tired. Not feeling hungry.
Dark-colored urine, pee.
Weight loss without a known reason.
Jaundice, having yellow-colored skin or eyes. Swelling in your legs.
Itchy skin all over.
How can I find out if I have hepatitis C?
The only way to know if you have hepatitis C is to get tested.
Talk to your doctor about being tested, especially if you are at higher risk.
Hepatitis C and kidney transplants.
Kidney transplant is considered the best treatment option for patients with kidney failure.
If you decide you want a kidney transplant, you must be tested at a transplant center to see whether you are ready for the transplant surgery.
This evaluation looks at your physical health, mental health and financial status. Getting a kidney transplant when you have hepatitis C.
You can still be allowed, to get a kidney transplant if you have hepatitis C.
When you have hepatitis C, your transplant team will consider the health of your liver, if your liver is badly damaged, you may not be recommended for a kidney transplant. In certain cases, if your liver is damaged but you are healthy otherwise, you may be considered for a kidney and liver transplant at the same time.
If you are approved for transplant, your doctor might suggest you get a kidney from a person with hepatitis C, or from a person without hepatitis C.
Getting a kidney from a person with hepatitis C. Getting a kidney transplant from someone who has hepatitis C might allow you to get a kidney transplant faster, because hepatitis C positive kidneys are less in demand.
You would then be treated with medicine for hepatitis C after the transplant surgery. Getting a kidney from a person without hepatitis C. You would stay on the regular waiting list for a kidney transplant, and be treated for hepatitis C before the transplant surgery.
In the past, treatment for hepatitis C could cause problems for the new transplanted kidney. Now that new medicines for hepatitis C have been created, this is less of a problem.
Work with your doctor to decide which medicines for hepatitis C are best for you if you are considering a kidney transplant, or had a kidney transplant.
Getting a kidney transplant from a person who has hepatitis C when you don't have hepatitis C. Within the last few years, there have been a few cases where doctors transplant a hepatitis C infected kidney into the body of a person without hepatitis C. This means that when you receive your new kidney, you will probably become infected with hepatitis C, but once you receive your new kidney, you are treated with drugs to cure the hepatitis C.
The health of people who receive a kidney transplant is better than the health of people on long-term dialysis.
This makes getting a kidney transplant the top priority.
Since hepatitis C can be cured without too many side effects, this is now being considered as an option.
This type of transplant is still being studied by researchers, but has shown very positive results for patients who have had it done so far.
Treatment of hepatitis C.
The goal of treatment for hepatitis C is to decrease the viral load, the amount of the virus, in your body until the virus is no longer found in your body.
In the past, only two types of drugs were available to treat hepatitis C, interferon and ribavirin. Interferon and ribavirin were used together and were successful in treating hepatitis C. Now there are new and better medicines for treating hepatitis C. Direct-acting antivirals, DAAs, are now considered the best type of treatment for hepatitis C.